So social health protection has always been a worldwide concern. Firstly, Universal Declaration of Human Rights notice that access to health is a fundamental right of human. That means that all the states, all the government have to make effort to set up some system to allow everybody to access to healthcare. Secondly, International Labour Organization is convention number 22 in social security minimum standard set 9 branches of social protection, which include access to health. So all the member states of ILO are obliged to set up system, mechanism to allow people to access to healthcare. In 1917, Almaty Declaration of World Health Organization was about health for all. And it is said, health for all will contribute both to a better quality of life and also to global peace and security. So we can notice that access to health has always been a worldwide concern. In 2000, the Millennium Development Goals set 8 Millennium Goals. And 4 of the 8 Millennium Goals was about healthcare. That means that access to healthcare is very important, both at national level and at international level. So you have other declaration, resolution, who were about access to healthcare. In 2005, member states of World Health Organization commit to develop the health financing system so that all people have access to health service and do not suffer financial hardship paying for them. It is too important. So the aim of health financing is to allow everybody to access to healthcare without suffering for hardship, financial hardship. And in June 2012, the Social Floor Declaration provides guidance to member states. All people must access to basic service, and access to healthcare is one of the basic services. So all the member states of ILO are obliged to set up system, mechanism to avoid people suffering when accessing to healthcare. And finally, in December 2010, the General Assembly of United States adopted a resolution on universal coverage, which put emphasis on the importance of universal coverage for achievement of Millennium Development Goals. So we can notice across all those resolutions, recommendations, that access to healthcare has always been a worldwide concern, both at national level and at international level. But instead, all those recommendations, now we can say that in many countries, we are far from achieving that right. In many countries, people suffer when they seek for health. So this course on social health protection will help us to understand why this difficulty and what can we do in our country to go forward universal coverage. So that is the first introduction to tell you why access to healthcare is important. We will now try to understand what is social health protection. And I will start by speaking about concept. Firstly, ILO concept. ILO concept says that social health protection is a public or private measure against social distress and economic loss caused by the cost of treatment. So, in social health protection, you can have public measure, private measure, but the aim is to protect people against social distress, against economic loss caused by cost of necessary treatment. And ILO says that the overall objective of social protection policy in health is achieving universal coverage that leads to effective access to at least essential health care for all in need. So the aim of social protection is to allow everybody to access to at least a basic healthcare service. And the ILO social protection concept sets some parameters, some dimension. Firstly, legal coverage. So for ILO, social health protection has a right-based approach. Legislation in country must deal with social health protection. Secondly, effective access to healthcare. Effective access to healthcare depends on 4 parameters. Firstly, health services must be available. Secondly, they must be affordable, and financial protection, and at least quality. So that is the dimension of the concept of ILO in health social protection. So this dimension could be measured by different parameters. Firstly, affordability and financial protection. You have different parameters. Non-existence of financial barrier to access to service. Financial contribution in relation to ability to pay. So all the mechanisms must be progressive. People must pay for health according to their ability to pay. Absence of catastrophic healthcare costs. Absence of impoverished due to healthcare costs and inability to generate income. So for ILO, the 2 dimensions, affordability and financial protection, can be measured by those conditions. Availability and quality, excellence of social health protection at the systematic, organization, and managerial level, excellence of service delivery system, and availability of a set of essential service. So to sum up ILO concept in social health protection, we can say, firstly, it is a right-based approach. Legislation in country must deal about social health protection. Secondly, financial protection. And thirdly, available of healthcare service. So you have 3 dimensions in ILO concept of social protection. Now, what is about World Health Organization? World Health Organization tell about universal coverage, universal health coverage. And all people have access to health service and do not suffer financial hardship paying for them. This is the conception of World Health Organization about health social protection. And World Health Organization set 3 dimensions. So moving toward health coverage, the main state to work on 3 dimensions. The first dimension is population. Who is covered? How many people are covered by health protection scheme in a country? So working in this dimension means to extend social protection to non-covered persons. The second dimension is service. Which services are covered? Which services are covered? Working in this dimension, the main state to offer more service to people. So we have to work in every country to offer many services to people. The benefit package might contain a large number of services. And the third dimension is direct costs, the proportion of the cost covered. So in the country, if you want to assess the social protection system, you have to look at the 3 dimensions. How many people are covered? Which services are offered? And which proportion of health service costs are covered? That is the World Health Organization conception in social health protection. So what can you understand, generally understand, to avoid conflicts of concept? We can just say that social health protection means access to health service is guaranteed to all in need without being exposed to financial risk. So the 2 concepts are important. Access is guaranteed. We have just talked about right-based approach. And people mustn't suffer for financial suffering. So that is what we can say about the concept of social health protection. So it is an example to emphasize on what I have just said. It is useless to have a good financial risk protection system if health services are not available or quality of health service is bad. So it is useless if you haven't health service to set up a financial risk protection. And the example, in many African countries, before initiative of Bamako, access to healthcare was free to everybody. But there wasn't health service. Health services are not available, or quality of health service was too low. The second message is it is useless to have a good healthcare service system if people cannot access to it. Example, in America, before Obamacare. In America, you have good infrastructure, you have many health workers, but people prove many difficulty to access to healthcare. So we have to work on the 2 dimensions. We have to work on the 2 dimensions. Action on healthcare provision, availability of quality health service, and action on healthcare seeking, financial risk protection. That is important. 2 dimensions, availability and financial risk protection. So that is the end of the introduction to put emphasis on what is social protection, to tell you that social health protection has always been a worldwide concern, and which are the dimensions on which we have to work to move toward universal coverage for everybody. Thank you.